When I think about a healthy community, I think about a community that takes care of one another. To deliver on our mission and to serve our communities, Bozeman Health is embarking on the most ambitious campaign ever in its 100-plus year history. At its heart, the Caring Forward campaign has 4 fundamental priorities, which together will provide a foundation needed to advance our community's healthcare well into the future.
The first pillar of the campaign is really the bricks and mortar of building a new ICU. If you've ever had a family member that's in our ICU, it's very cramped quarters, very difficult for the family to stay there with the patient. As I think of someone like local chef Ranga Pereira, who suffered a heart attack at age 36, this new state-of-the-art facility would be incredibly meaningful to him and his family.
For me, having a heart attack at 36 years old, it was very, very, very close. Working back in time, understanding what they did for my friends and family and taking the time to explain things was tremendous.
Patients and families experience healthcare and critical care services together. And so creating areas and space where families feel comfortable, that's really important to Bozeman Health.
The second segment of the campaign is the neonatal intensive care unit. And if you think about the most fragile patient we serve, it's the young baby.
I think as a mom, I was not worried about myself. I was terrified for my children. We're so grateful for the care that we received. It was unbelievable care, and our nurses and our doctors, we will never forget. But we will also never forget what it felt like to be out of our hometown when we had our babies.
Innovation and excellence is near and dear to my heart. The concept that we will raise money for the latest technology and the latest equipment specifically for cancer care and for cardiac care is essential for our growing community.
I just assumed that I would be in Salt Lake until I was put back together completely. Chemo, plastic surgery, everything. And my oncologist both said, well, Bozeman has a top cancer center. I'm certain that you would get the exact same treatment there than you would here. And I probably just walked out the door right then. The opportunity to have the same treatment at home so I could sleep in my own bed every night. That's what brought me back to Bozeman.
One of the things we need to recognize is that we are a very large rural community. Bozeman, Big Sky, surrounding areas all need to be served. And it's been a dream of mine for 15 years to see healthcare in Big Sky. Having healthcare right out the back door, so to speak, is very crucial. The final pillar of the Caring Forward campaign is outreach and access. And to me, the most important sense of community we can possibly have is that we take care of each other.
When these bills come along, it takes away a lot of your hopes and your dreams that you have been financially planning for.
Healthcare challenges can strike anyone at any time. Bozeman Health recognizes that we need to bring the resources to the folks who need them most. That could be outreach through our Community Connections program. It could be health fairs. And it's also helping folks with the financial burden of medical care. Bozeman Health's mission is to improve community health and quality of life. But we provide more than just health care. We provide compassion, we provide dignity, and we provide hope.
Healthcare and well-being are paramount in any community. Caring for those in need is an essential part of who we are. But our work is not done, and that is what this Caring Forward campaign is all about.